Hello, my name is Julia Buvalec and I am a nurse. I would like to present for you a short film regarding oral hygiene. The purpose of oral hygiene and oral toileting is to remove any food debris, remove any bad odours, tastes, and improve the patient's general well-being, as well as preventing any infections. Prior to beginning the procedure of cleaning our patient's mouth, we need to explain the entire procedure, what we are going to do, how we are going to do it, why we are doing it, and ask for our patient's consent. Next, we need to prepare all of our necessary equipment, which we will need to carry out the procedure. The equipment is gauze, a cup of water, a cup of solution for oral health, a kidney bowl, non-sterile gloves, a toothbrush, soft bristled with a sponge, Vaseline. Before we begin, we need to ensure that our patient is in a sitting position to avoid any choking. We can secure their chest area with a towel. Oral health can be carried out using two methods. The first method, we use a piece of gauze wrapped around our finger, soaked in oral care solution. We start with our patient's upper jaw, cleaning the outside area, outside surface of their teeth. Next, we move on to their cheeks, the inner surface of the teeth, and the palate. Next, we move on to the lower jaw, where, in a similar fashion, we start off with the outer surface of their teeth, the cheeks, the inner surface of their teeth, and then the tongue. The gauze can be replaced as needed, as you see fit. However, on average, during the entire procedure, we will use around 10 pieces of gauze. The second method, the second way of carrying out oral health is using a soft bristled toothbrush with a sponge on the other side. The method, the order of cleaning our patient's mouth is the same as previously shown. Once we have done that, we can wipe our patient's mouth, making sure that the entire area is dry, and secure their lips with Vaseline or a vitamin cream.